Hello, guys. I just finished part one of fat grafting explanation. Okay, so this is part two, where I really talk about the methodologies that we're using to facilitate or enable uh, survivability of these fat cells that are put in another part of the face, right? So the part one was just a general high level process. But I want to review that quickly before I go to the next one. So what we generally talked about in the few minutes, in the part one video, is we can harvest fat from the arms, we can harvest fat from the belly, we can harvest fat from the inner thigh area, outer thigh area, different areas. Okay, there's fat under the neck also, but we generally don't use that for fat grafting purposes. We can inject fat in the folds, in the lips, in the chin, in the line here. We can inject fat in the general cheek area. We can put it under the eyes. We can put it on the upper lids. We can put it in the temples. We can really pretty much use the face as a palette to put fat wherever the surgeon, the quote unquote, the surgeon artist feels is necessary to make the face rejuvenated and look better. We also talked about the fact that the most common site we get fat from is the abdomen and the inner thighs. It's usually injected with some numbing medicine, which has some fluid. And when you harvest the fat out of those areas, you always make sure you leave behind a healthy amount, because one of the intuitive things people think about is that remove as much fat as possible. No, 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 no. It's more important how much you leave behind than how much you take out. Because if you want to get a natural contour without any dimpling, without any issues, and leave a very nice skin template behind, the skin needs a good buffer underneath the skin to have a very healthy, smooth surface. Okay, but for fat grafting purposes, we just remove what we need, and the quantity we remove is usually about 10 syringe fills. 10 each syringe has about 10 cc's of fluid or the fat cells in it. The syringe is about maybe the size of this. This is a good measure of one syringe. So we get 10 syringe fulls of this limit, this quantity of fat. That fat, I already told you guys before, that has some dead fat cells, maybe some disrupted fat cells, has some fluid and things like that. So we discard all of that stuff. And the only stuff that we really want is good fat cells with some surrounding healthy stuff that it comes with, and some stem cells that fat also has, right? That's the key factor that we discussed in detail last time, is that fat cells have what we call stem cells in it, or pericytes in it, that are very important for regenerative potential of what they can do. So they, wherever you put them, they help the general environment to improve the health of those tissues around it, or transform into those cells that are now healthy cells. So that's what we talked about. Once we discard all the unwanted stuff, we get that into a new syringe that has just the healthy stuff, and we put it, like I talked about, all over the face. This can be used in the breast or some dimpling from other parts of the body, but we're talking about the face today, so that's what we're going to focus on. Okay, that's the quick summary of what we talked about last time. Now, what are the key differences between fillers and fat grafting? Okay, fillers come pre-made. Okay, pre-made. One, come in 1 cc syringes. They are made of what we call hyaluronic acid compound or others. They are predictable, come in different thicknesses. So it can be used in different parts of the face, because you don't want to use thick product in the lip or vice versa. So thick products can be used in certain parts of the face, thin products can be used in other parts of the face. It has a cost based on quantity, meaning the more syringes you use, the more cost it is. So one syringe costs, just to throw a number out there, $100. 10 syringes will cost $1,000. That's not the actual cost, but I'm just, for math purposes, that's what I'm saying. But so there's advantages, right? And it's no surgery, immediate results, can remove, dissolve if necessary. Not all of them, but some of them. Okay, so let me review this again because it's a lot. It's not an exam, but I just want to make sure that everybody understands. So fillers that come in pre-made syringes that you purchased, and a lot of the very popular, done every day. They come in pre-made syringes. They come generally in 1 cc syringes. The quantity is fixed. These are usually what we call hyaluronic acid products. Juvederm, Restylane, RHA, things like that. That's what we're mostly talking about. Or others, there's others, like I said. They are predictable, meaning that they work every time. They offer different thicknesses so that different thicknesses can be used in different parts of the face, because the lower lids need thin product, the lip needs thin product, cheeks need thicker product, so you have the versatility of the thicknesses. The cost is based on quantity, so there's a fixed cost per syringe, and the number of syringes that are used is what is used to determine how much the cost is, and it's up to the physician and the injector and the patient to decide what that is. There's no surgery required. There's really immediacy of results because you see it on the table, and you can remove or dissolve it in case you don't like it. And there are no allergies, and there's really no preparation. You basically come and get it and go home. Occasionally, you get some swelling and bruising, maybe, and that can cause some concern for patients, but it's not common. Okay, so that's the fillers. Fat grafting, on the other hand, needs a much higher skill level. Okay, requires high degree of experience, needs more work to get it done, because you have to remove the fat from the same person, you have to put it in another location in the same person, so it requires a bit more work and a bit more time. That's what it takes longer. You have to some degree overfill it today. Okay, we're trying to get to the point where we don't have to do this because we can make it work predictably, but you have to overfill it. So people, it's not as predictable, meaning that it may not work on everybody, it may not work the same on everybody, and it may not, it may work well in some people, and even in one location, some of it may work well and some of it may not work as well. And may need more than one session because, like I told you, some of it, kind of goes away. So if that's the case, you may have to do more times, because it can resorb or go away. And sometimes patients get more bruising and more swelling. So if you look at this, and I present these options to you, I would imagine most of you would choose this for obvious reasons, right? Because this sounds a bit morbid, but the possibility of permanency, regenerative potential, fixed cost, in my opinion, trump everything else. Okay? So, having presented the good, bad, and the ugly of the two sides, I want to make sure I make it clear that the opportunity or the possibility of getting permanent results, the ability to get regenerative effects or stem cell based effects of skin health and general health of the tissues, and also to do this at a fixed cost where there's no per syringe cost, trumps everything else here. Okay, and when I talk about taking a little longer, more bruising, more swelling, these are limited time periods. These are not months on end, right? I'm talking about maybe, if it takes me 20 minutes to do this, this may take about an hour, hour and a half to do, as an example. If this causes no swelling, this may cause some swelling for about 3-4 weeks perhaps. If this causes no bruising, this person who has this may get some bruising for 2-3-4 weeks perhaps. So short term, this definitely looks better, simpler, easier decision. But if you're a long-term thinker, if you were to believe in regenerative medical purposes or medical procedures, if you were to believe in the ability of your body to heal itself, if you were to figure out that you have to holistically treat tissues, this will always trump everything else. As a surgeon, if I had an opportunity, this is what I would choose for those reasons. Okay, permanency possibility, not saying guarantee, but possibility, regenerative potential with stem cells, and fixed cost of it, right? You have to assume that both are very, very safe in experienced hands. So I'm not even discussing that, okay? And moreover, fat grafting, because it's your own material, the patient's own material, there is no cost per syringe. It's just done as a procedure. So if I need 10 syringes, I get 10 syringes. If I get 20, I get 20. If I get 100, I get 100. Whatever it is, it is. So there's a fixed cost to doing this procedure, and the surgeon and the patient will decide what areas are injected. However, in this case, you have to decide how many syringes I'm going to use. What is it going to cost? Do I want to do one area or two areas because that's all I want to do today? Versus when you make a decision like this, the idea is to basically treat the whole face at one time as a procedure. I hope that is very, very clear to you guys, okay? So if patients ask me what I would choose, in experienced hands, I would choose this every day of the week. However, if I'm uncertain of the look, okay, if I'm nervous about how I'm going to look, if I change my volume of the face, this is a good way to go as a trial, all right? Because, if this becomes a permanent result because we're lucky and everything works as predicted, that's going to stay, right? And you may be nervous, oh my God, I don't know if I'm going to like it or not, or whatever feelings you may have. So if you want to have a trial basis, you can certainly do some fillers first to understand what it would look like. Because if you don't like it, you know which areas don't look good to you. And then if you don't like it, you can always dissolve it, like I said, right? In here, that's not possible to do. So in some patients, I advise that let's do this as a trial to see, but then these patients have to understand that there's a cost associated with this, right? So of course there's multiple factors that go into making a decision, but as a comprehensive surgeon, which is what I call myself, I never try to do shotgun solutions, right? They never work. So just going somewhere, getting a little bit of something here or there, you can imagine that it worked or not, or I have no idea, but a lot of people say, oh, I did something, nothing worked, because it wasn't thought through fully, it wasn't thought through holistically, it wasn't thought through with long-term plans of what we're actually trying to do to the face, what are we trying to change, is this the only thing that works for you, do you need other adjunctive procedures to make things better? So all these are necessary to discuss with the surgeon. You should not, in my recommendation, just go and do a little something, oh, I'll just do a little something. That typically doesn't work. You should have a conversation. What are my needs? What are my goals? What do I like? What do I not like? What areas bother me? How do I address each area? Because fillers are not the solution for everything. Fat is not the solution for everything. Surgery is not the solution for everything. Sometimes you may need a little bit of everything, right? There are patients who are very skinny and don't have much fat to spare anywhere, right? And there are some patients who don't want an extra site to be operated on. On the other hand, there are certain patients who don't want to keep coming for fillers every year either. There are patients who can't afford to do the whole face on one go because they can't afford to open 10, 15 boxes of syringes to use, because there's a cost with it. Whereas in here, you could use as much fat as you need because it's treated as a fixed price procedure, right? So there's a whole host of factors that go into making a decision like this. So cosmetic surgery, just like any other field of healthcare, medicine, aesthetics, has to be thought of seriously, has to be done at a serious facility with well-trained, certified surgeons who do this for a living every single day, not as a hobby or whatever, and do it with consistency of results, safety, and things of that nature. Okay, so this is part 2 of the video. There's going to be yet another part of the video that we're going to do. Again, like I said, what am I specifically doing to improve the permanency and predictability and reproducibility of the results? Okay, there are some very neat, innovative things that we're doing at Plastic Surgery that I've done several cases of those already, and I hope to share with you guys what those are as I get a bit more concreteness around the process, because we're tweaking it, we're improving it, we're trying new things, but definitely seeing improvements in the results based on these newer learnings that we are getting all day, every day. Okay, thank you.